Good morning, everyone. I hope that everyone can hear my voice clearly. So if you can't hear, please raise your hand or interrupt me to let me know, yeah? So today's topic is basically, this is our Meta Journal Hours 18. So I'm Salwana, a research officer from CRU. I'm going to appraise a qualitative paper today. All right, today's topic, the paper is titled The Illness Experience of Long COVID Patient, a qualitative study based on the online Q&A platform, Community Zihu Apps. So this paper published by a Chinese researcher from China, Yiwang and the team. Okay, basically this paper is trying to explore, as you can see, I summarize here the abstract, to explore the illness experience of long COVID patient in China. And the authors want to know how this patient, long COVID patient, adapt to their illness and how they build or reconstruct their life again after the illness, after recover from the illness. And this study used a qualitative study approach, which is grounded theory and coded the self-produced tests of long COVID patient based on the largest online Q&A community, Zihu Apps. All right, from the WHO definition, long COVID basically occurs in an individual with a history of confirmed COVID-19 infection, usually 3 months from the diagnosis of COVID-19, and it appears with symptoms that last for at least 2 months, which cannot be explained by other diagnoses. So the problem stated by this paper is basically the background of the confirmed cases in China. So they have around 153,000 cases as per 1st April 2022. So this paper is limited to up to 1st April 2022. So basically among of the confirmed cases, 10% up to 30% of the patient will develop long-term symptoms that is around 15,000 patient in China. Then the number is growing basically. So few studies in Western countries basically have focused on the self-narrated illness, the experience among of the survivors of COVID patient, but less attention has been focused to this group in China. So if we go back to years since 1975, among of the researchers or scholars in this field, like Strauss and Glaser, they focus only on illness and the patient experience in certain topics like illness experience, patient coping strategies, interaction between illness experience and social structure. But towards now, all of the researchers, they shifted to the experience of people with COVID-19 and those who are recovered during pandemic. So the authors basically found that this topic of the narrative or the experience of people with COVID and those who recovered during the pandemic, especially the long COVID patient, is less studied. So they have less information or evidence to be referred to. So that's why they try to do this study. Okay, previous findings stated in the paper that patients that are institutional or emotional struggle, patient that has developed long symptoms of COVID-19, they face an institutional and emotional struggle throughout their illness. Also, this condition also impacted their illness experience at home when they have been quarantined at home or at the hospitals. So this experience also developed their high risk of mental health issue like anxiety, depression, insomnia, and so on. So these participants also experience a severe level of psychological distress, but they can cope with the condition through their high level of health information seeking behavior. So based on this previous finding, the authors also think, or they try to do, to analyze patient perspective from their narrative that they feel that to support this group to understand their current living situation, because they feel that they have insufficient studies that support these insufficient studies to help the patient to cope with the illness experience with COVID and long COVID, and also this condition is new disease and much unknown information that need further research. So objective of the study is that the authors want to explore patient illness experience through their narrative of the illness on the platform, on Q&A platform called HSAAS. And from there, they want to understand how this patient adapted to their illness and reconstruct or rebuild their life back against the normal. Okay, in this study, the authors collect the data based on qualitative study approach, which they use grounded theory. Basically, what they have from the HSAAS is actually a pool of data like this Lego. They have different type of data, like from this Lego, you can see different colors, different types, the lengthy and the short Lego. So it's similar to the comment or narrative of the patient, of the long COVID patient. So from there, they gather all of this information from the HSAAS and they try to develop the theories that support the condition, the illness, and how this patient try to reconstruct their life again. So the basic summary or information about this grounded theory is that the researchers collect and analyze data and they try to derive the theory from that. And this process happen repetitively, which the researchers may start with small answers from the HSAAS, and they try to derive the theory, and then they come back to the apps, they find another answers that are similar to the previous one, and then they use that to support their theory that they have derived from the beginning of the process. So basically, the data that they have from the HSAAS basically real world data. So that's why they use this grounded theory approach. And this process, of course, happens repetitively until they reach a point called saturation point, which they stop the data analysis and data collection. So basically, the researchers or the authors from this study, they found that this study, this grounded theory is suitable to be used in this study because it can develop concept and model from the information grounded in the data, and then the data can explain the context of the text rather than to prove a theory or assumption or hypothesis. And from there, they also can construct a model of long COVID patient illness experience in China, and they feel that it can be used in other study by other researchers. Okay, this is the HSAAS, the basic information about this app. Is basically, it is a Q&A, largest online platform in China. So it is, in Western country, we have Quora, but this is developed in China. So this is a very large platform, basically. So it serves as a knowledge sharing platform where users can ask questions, receive answers from experts and community. They can share knowledge and then they can engage in discussion. And brief information about these apps this app is used among of the professional in industry, from IT background, from healthcare background, from laws, and so on. So it is not intended. So this app is not intended for the social media like Facebook. No, it's actually a well-developed platform for professionals to discuss things, to get response, and so on. So among of these users are bachelor degree and above. So 80% of them are bachelor degree and above, and 2% of the users are actually PhD holders. So this group actually publish only intellectual questions and issues. It's not like, so like Facebook, just not to discuss main things, a few things, or just to socialize. No, it is a very well-developed platform, professional. So from this platform, the authors choose 4 steps to select the topics and then to extract the data from the apps. So first of all, the authors choose the topic from the apps. They find the topic by search key point of COVID-19 pandemic. So from there, the the apps generated around 250,000 discussion as per 1 April 2022. So the process is quite lengthy basically, but they try to filter the answer, browsing and screening all the answer, and they come up with only 2 questions with good quality answer. So the question are, what are the sequelae of COVID-19 and what happens to people who have had COVID-19 now? So from these 2 questions and good quality answers, they come up with 908 answers, which they transfer or they obtain via Python. So, but in this study, they didn't explain or discuss how the process they extract the question and answer transfer to Python. So I have no idea how they did that basically. So from there, they screen all the data and they eliminated invalid answers such as advertisement, non-patient self-report, and then not related answer. So the final answer they gained was around 64 answer. So basically, they only filter answer from survivors of COVID-19 that tablet symptoms. So it's a long COVID patient, long COVID patient with symptoms. So from there, they after they clean all the data, they import the data into NVivo 12 as a raw data before they do the coding process. Okay, this is the previous method where they bring or they transfer the original data, 64 answers, to the NVivo 12. So they some word frequency query to obtain a high frequency word cloud match. So in NVivo, they obtain all of this word after they filtered it. So from these keywords, they do a coding, 3 types of coding, which they run it concurrently, that are open coding, SL coding, and selective coding. So basically, brief summary of this coding from the raw data that they gain from the platform. So they do an open coding process or analysis, which they turn the data into small discrete component of data and then put a label or codes into the data. And then after that, from the codes, they try to find connection between the code and then they put some categories into that. And then later on for selective coding, from the category, they find or they derive the core category from all of the categories that they gain from the process. So it might be confused by now. So I try to put it in a simple way, how the process were done in the study. So the first step, just now we mentioned about open coding. So remember that they have a pool of data and then they put into small pieces of data and then they put code. So this is where they have collected self-reported or narrative or answer from the apps. So they put into small pieces like this one. So they name it A1 to A41, sorry, A47. So they have 47 of small narrative or answer of the user. So they put it A to A47. After that, they put that into the codes, into small category, A1 until A47. Yes, and then after that, they put some comparison using open coding. They come up with only 15 category, A1 to A15. So this is the summary of the data that they have for the open coding. So you can see here that for the open coding, there are some information about the physical, information about their physical, medical examination, sense of their losing of their control of their body. They feel about the illness, and then how they try to cope with the image of them after illness. And then they put second part and the third part because it happens concurrently. Actual coding and selective coding, where from the 15, previously A1 to A15, they come up with the main category only 6, B1 until B6. So B1 to B6 and C1 to C2, we will discuss later on about the, this is actually how the theory derived from their findings. So B1, actually the return of the sick role, divergent body self, stigma and self-stigma, push forward the biographical flow against impression management and self-compassion. So from these states, they come up with core categories at the end of the process, which they call it C1 and C2, the disordered body life and reconstructing self and life. So basically, at this stage, they already reached the saturation point where they put five random question or five random answer, just to make sure that when they gather other information to support the theory, is actually no theories or no new information to support the theory, is actually feel enough. So the authors feel enough that they have already reached to the point that the new information does not help them to have another theory. So it's just enough. So this is the summary of the main category and core category, same as previous slide that I mentioned here. Main category and core category. So this is the finding of the study. So from here, we will go one by one to understand what are the findings. Okay, by the definition, the diagnosis of the clinically cured COVID patient is that they meet the following criteria, which their normal body temperature are more than 3 days. They have improved their respiratory symptoms. They have obvious absorption of information in imaging, and they have negative nucleic acid test twice when they retest the samples within 24 hours. Okay, this slide basically highlight how the patient feel about their illness, about their condition, which after they discharge from hospital, they feel that they are normal, but they go back to the sick condition or situation again. So that's why the authors put it the return of the sick role. So where the patient feel that they have reverted from normal to sick after being discharged. I stated in the papers that long COVID patient who experience symptoms lasting for at least 2 months and cannot be explained by any other diagnosis, they confront a very chronic condition with no specific treatment or diagnostic. So they feel that they are helpless. So when they go out, discharge, and then they feel sick again, but no cure for them. So they said here is that I thought that I discharged and all would be well, but only to find out that I seem to have another disease, one for which there is no cure yet. So this is what they feel about their illness. And now there are many physical sequelae like constant headache, dizziness, eye, pain, bloodshot eyes, and so on. So I have been to the hospital many times and many tests done on my chest, lung, and so on. So here is stated that I feel helpless and pain, but no one can understand it and no one to talk about. So this is their feeling about their illness. And then they also feel that their experience on the illness is less important. It's not really important when the doctors only focus on the medical tests, on the imaging. So they feel that because of these feelings, so they develop some mental health issues like anxiety, where they feel that they are helpless in treating their condition. So here it's stated that the doctor unilaterally felt that my headache was just caused by stress and also suggested me to see a psychiatrist. So this is basically tell you about the feelings of the patient. So they feel after discharge, they feel sick, and then after discharge, they feel sick. They feel normal after discharge, but then come back to sick again. And then secondly, they feel their experience is not important, and then from there, it leads to anxiety among of the patient. Okay, secondly, the slide tell you about how the patient feel about their illness in terms of they feel that their body cannot they feel that their body is not the same as before they got COVID-19. So the authors highlight that there is a gap between their bodies and their self. It's like their mind cannot be connected to their body. So their bodies does not necessarily change in response to their self-sense. So here they feel like their body is not responding to their their sense of self in the same way as before. So as staying here, I ask myself over and over again, is it me? Is it really me? I used to run in kilometer in the school sport day with ease, but now I can't even walk up the stairs without fainting. So the patient also tell or describe about their physical sensation, which they feel that they cannot control their body and it feels strange and unfamiliar. So it's stated here, my body no longer seems to be mine. My hands sometimes shake uncontrolled as if someone is manipulating my body behind my back. So from here also, they feel they have a negative perception due to difference between their current physical as compared to previous. I feel like I have become 80 years old granny, feeling helpless and powerless. And the third one, the stats highlight the stigma that the patient had, not only from their self-stigma, but also from others, from the family, from the communities and people out there, from their colleague at workplace, due to discrimination that they have because they have COVID. So the self-stigma make long COVID patients lost their self-worth, and they see themselves as a burden. And by right, no one has the right to discriminate or stigmatize them. So as mentioned here, they were implicitly labeled as inferior labor, which they were treated unfairly and not given equal opportunity as other workers. So as stated here, I've been waiting for months. I still haven't been hired. I've had my nucleic acid test done so many times that I can remember. All departments are afraid of taking the blame, so they are passing the buck to each other, which I know. They're afraid that I will retest positive again, but I have never retested positive. Now I'm being labeled a plug instead. So this slide basically tell you that the COVID patient, non-COVID patient, they had a discrimination not only at their workplace or at home, but also at a local or social level. So this basically lead to the breakdown of social relationship that the patient have put had before, and they maintain for decades. So it's like everyone look down on them. So like you see here, as said, when I meet colleagues, some just say hello at far distance and walk away. Some haven't spoken to me again so far. Some take the mask out of their pocket as soon as they see me and put it hastily. So before the illness, long COVID patient may have seen as valuable members of their group, but after the illness, this group rejected them. So in this situation, basically, they feel that discrimination of their condition has led them to feel that they are a burden to the society, to the family, and to their self. Right. All of these three items basically tell you about their illness, their experience of the illness. And next three items down here will tell you how they actually develop from the illness and then be a new person. And then how they develop, how they motivate, how they face or cope with the situation. Okay, this is another part of stigma and self-stigma, which okay, this slide tells you about the poor health knowledge among of the public. So because of the public has weak knowledge about the COVID-19, so it basically leads to the misinterpretation or misleading information among the public, and then they publish it somewhere by the social media, so it might it creates actually a situation that against of the patient. So the patient will feel that they are burden to the community, so they are rejected by the community and they cannot face it actually. So as you can see here, it says that in the 6 months since I was discharged from the hospital, I have had little contact with relatives I used to be close, let alone visit them. My best friend more than 10 years said when I was in hospital, she wanted to meet me. But after I was discharged, she immediately changed the subject and even didn't want to meet me. So also, it tells you here that my personal and family information is transparent in the community, and my unit and everyone is focusing on me on guard against me with frequent tests to prevent my retest positive. So this is the stigma basically had by the long COVID patient. Okay, this section tells you about the how these patient long COVID.
Savannah, may I stop you for a while?
Yeah.
So in qualitative research, when we come to these are the themes, though in the paper they say it's a core category, the standard terms that qualitative research use is like the reconstructing self and life and the disordered body and life are the themes. It should be the themes, themes. And then those that come under this, there are three, right? Is supposed to be category. Though the paper is said main category, core category and main category, they use slightly different term. So I hope if there are qualitative researchers among us, maybe you can make a comment whether it's also fair to use different term lah. If you want to go along using the standard terms, there are themes and category here. That's the right term to use lah. You don't, if you say sections then become quite a layman lah. Yeah.
Okay.
Yeah.
They use main category here, and then this one is code. Yeah, core category here.
This one. So the earlier one is actually like code lah.
This one is code.
They mentioned initial category, but it's a code lah, coding. But it's really come from earlier, isn't it? There's a small letter A, and then they become this capital A, and then B, and then C. This I think is fine. It's quite free for everyone to choose how they code. They use the code, the label. But I think the terms they may want to use the more standardized way of categorizing the themes and the category and all that lah.
Okay, Prof.
Yeah.
Okay, Prof. Thank you for the updates.
Yeah, use the right term.
All right. Can I continue, Prof?
Yeah, sure.
All right, we have actually reached to the section that this paper highlight how the patient reconstructing their life after their illness. So the text highlight about the how the patient readjusts the changes that the illness brings to them from loss to gain and push forward to become new them. So in this section in the paper, it mentioned that a continual reminder to patient to reorganize their life value with the previous desire for money and promotion, change to enjoy the present moment and pursue health. So I mentioned here, although even life is hard now, I have faced the future positively. So they try all the things that I was afraid to try before. And here it said that now I have come to realize that there is nothing more important than health, and it's better to spend more time with myself and my family than to waste time on overtime. So the survivors change their mindset and their lifestyle. So COVID-19 also bring huge to their life. So they found that these changes have motivates them to find new ways of life, so to achieve new target or goals. So like here it said that I used to love bungee jumping, but now I've been advised by my doctor because of the condition of his health reasons, so he has changed to do embroidery. So he find that I'm quite talented, so I think it's she here. So I like to try out for the city embroidery competition next. So this section, because of the illness, they try to they try to rebuild back their life. So doing something new, others than their previous life. So the second part.
Yeah? Sorry, Sauna, are you not kind of a surprise or find it weird the way they term this category? Well, it does not sounds anything that is, usual to me. What does it mean by pushing forward? I mean pushing forward. Okay, what is a biographical flow? It's
It's
very
actually,
new term to me.
yeah, I tried to read about biographical flow yesterday.
Okay.
This is basically in social science. So what I understand
Ah, I
from that is that,
see.
yeah, is something that after a sudden, it's not trauma, after a sudden something happened in your life, and then you try to readapt, or you try to,
Okay.
yeah, something like that.
It's
So
a scientific term
biography,
to social sciences, is it?
yeah.
Okay.
So from
Okay. So
something happened, and then they try to
sure.
change to a new,
Okay. Thank you.
new, yeah.
Thank you.
All right, this section tells you about how they cope with the illness, and then they try to be a new one, how they cope with their self-worth and self-identity. So this section tells you actually how they gain support and recognition from their respective groups. So they use coping strategies like hiding and denial to mask their feelings, basically. So they, in a situation that hiding is no longer effective, and denial has become the main theme of their impression management. For some chronic diseases, the hiding and the denial is quite successful because of the situation. But in COVID-19, is actually bring them to uh, it brings them actually to a certain level that affected their mental health. So it's not really successful in this COVID patient 19 with the symptoms. So like you see here, be denying their poor condition, they can build a healthy body image and break down the concern of others about their physical condition. When people ask me if I have any after effect of COVID-19, I choose to deny it. When I go to company or gym, some of my colleagues will ask me either I'm okay or not, or can you work out or not. I'm not happy inside, but I still smile. So I still smile and say I'm fine, and then I run 5 kilometers just to prove myself. So in terms of hiding, like said here, no one around me at the new school knows that I had COVID-19. And I'm the same as everyone else, and my medical checkup at the beginning of the school year was fine. I don't say a word about it. So in this context, they try to hide or to deny their condition so that they can be in the society. So they won't be discrimination. They will not be discriminated, and then they can develop their self-worth and self-identity. So from illness, COVID-19 patient to a new image, just to recope with their condition. And then last, the authors highlight about the self-compassion, that it is a very important way for long COVID patients to rebuild themselves and maintain their emotional health during the pandemic. So long COVID patients may experience some disruption in their life and negative emotion. So but individual resilience and mental strength can help them face these challenges with optimism. So as said here, it may have been hard to adjust at first, but in retrospect, it was a no big deal. So many of our public officials and medical staff are at work to confront the epidemic, and my hard work is nothing compared to their. So I'm just taking it as a training. So this is how the patient cope with their feeling. So how they handle and maintain their emotional for the illness. So as mentioned here also, the self-compassion of long COVID patient in a sense not only reach the state of acceptance but toward life, but also goes to a state of transcendence. Self-compassion become a powerful motivation for them to face up to life and rebuild it. As said here, in the past 6 months, I've been through a lot of dramatic things. I got engaged, then I got COVID. The groom broke off the engagement, lost my job, got re-employed. Life is always like this, so everything doesn't go smoothly. The most important thing is that your heart is always facing the light. So this is basically their self-compassion, how they maintain their emotional, their mental health, so that they can relive again. Okay, from the study, the authors found three main findings, and it is presented in this paper. Finding number one is related to stigma and self-stigma. This is summarized from the paper that patients with long COVID perceive visible or non-visible discrimination at work or social isolation, which worsen their negative emotion and social avoidance. So it is in line with other quantitative investigation that when a patient perceived discrimination, it will lead to their negative emotions such as depression and stress. So as we go back to the in the paper issue reflection on item 3.1.3, discrimination against long COVID patient. From this, when the public have lack of COVID knowledge, they will feel fear, and then it will create a suspicion and distance from the patient. And this happen at the societal level, although no evidence to prove that the COVID patient are infectious after a positive retest. And from this, it will lead to uncontrolled spread of misinformation and misleading information about COVID on social media. So this will lead the public panic and discrimination with the people with COVID-19 and the survivors. What the author suggests is basically how to try to find the best way to communicate health information to the public and to stop the spread of misinformation and disinformation about COVID-19. So this is the first finding. Second finding is about the impression and management, which the patient with long COVID have stigma that leads to avoidance-based coping strategies, and they found that there is a link between public stigma and staff stigma. So this finding also in line with other research study that when a patient face public stigma, it changed their the way of view on themselves, and it leads to the self-stigma, which trigger low self-esteem and low efficacy. So because of this also, they might lead to avoidance of seeking a medical assistance among patients and social support due to fear of discrimination. So this condition will lead to their reduction in quality of life and especially in happiness. Although it is reported in other chronic diseases that it is successful, but for this patient, patient with long COVID, it turns differently. And what the author suggests, we goes back as finding two is reflection to the coping strategies that the long COVID patient tends to use hiding and denial strategies to adapt with the discrimination and attempt to get rid of patient's social image and to tell people around them they are in fact healthy. So the author suggests that maybe psychological intervention are necessary for long COVID patients, such as a large-scale related psychoeducation program on COVID-19. So anonymous online counseling may also be a good approach to its privacy and accessible to patients. Finding three, it is related to self-compassion, where the authors found that self-compassion play an important role in reducing negative emotion and improving. This is consistent with other study that self-compassion as an intrapersonal resource may be effective means for individual to cope with tough situation during pandemic. So this study suggests that future psychological intervention for long COVID patient would try to improve patient level of self-compassion. So carry out also that they can carry out individualized self-compassion training just to help them cope with their plight and maintain their personal emotional health during pandemic. Okay, I've reached to
Sawana I may want to add something. What Sawana has elaborated or has brought us through is the grounded theory, the way the authors have come up with all these themes and also categories is what is known as grounded theory. If you have read the paper, they did mention a bit about grounded theory. So what they did, as Sawana has tried to enlighten us, the process was actually the authors look at all the online comment or answers about the topic. So they analyze the textual, the way they mention about the experience of post-COVID conditions, and the authors come up with all these themes and so-called theory, and these are the lived or experience life experience of those who have diagnosed with COVID and has some symptom about it. So all that kind of funny terms were actually theories, theories of how to explain the lived experience of those who were affected by COVID and now in so-called long COVID lah. So these are the so-called theories. So in future studies, if you want to expand on the lived experience, illness experience of long COVID, so this could be the theories that you can use. You can use to again to try to either confirm or you want to refute. True or not? Is it such as those this author found or reported in this paper? Is it true or not? Is it something about reconstructing life and reconstructing self and life? Is it something to do with disordered life, body and life? So it may be true to them, it may not be true in your population. However, this will be they try to explain something of those who experience the long COVID. So this will be the so-called the theories arise from the textual data, which the author you know copy from the online Zifu, is it? Zifu online Q&A.
Zihu.
Zihu or what? Yeah.
Yeah.
I mean, I hope if the authors, if the investigator has changed from total social scientists to health scientists, you may not get this result, you may got something else. But the process of getting the theories from the data and the process actually being influenced depended on the qualitative researcher and your value, your personal experience, your professional qualifications. That's why qualitative research, the analyst, the researcher who analyze the textual data is known to be a part of the analysis process, because you are in the data, you are interpreting the data, and because of you, this is the result. And if I were to be also looking in the data, I may come up with something slightly different or maybe totally different. So be aware of that. Yeah. So when you talk about the result, so whether you agree or disagree lah. Because some of the coding you may disagree,
Yeah.
and it depends on you. Yeah, because of your background. That's why in good qualitative report, the researcher or the authors, good one, they will actually declare who they are, why, their background, what they have gone through. By right, I mean we would want to believe them because they come from the same populations, so the same cultural background and value. So the way they interpret the textual data should be more accurate compared if Savannah or me would come in to interpret the data lah. Yeah, so bear that in mind.
Yeah, that's right, Prof. Because yesterday I discussed a bit with Iman about how to select the question basically, because there are many questions and how actually the researchers select the question. So how to put boundaries. Yeah. So I'm not sure how actually they did that, because the authors didn't explain anything about this, except 2 questions with good quality answers. Yeah.
Yeah, have you discussed this or have the audience commented on this?
No, not yet. This is based on
Not
my
yet.
discussion with Iman, only with Iman yesterday. Yeah.
Yeah, I mean this is in one thing this paper attracted me because you can, if you are very proactive, you are very productive and a researcher, you can actually use available data, and these authors have actually been very very so-called opportunity and productive lah. So actually, they actually look at the quality of this online. Well, you go and check it out also. Zifu, Zifu.
Yeah.
Yeah,
Yeah.
it's very meaningful, the Chinese one, the item.
Yeah.
So they are very selective. So whether we agree or disagree with the way they select the data, lah, is it must be more than 100 words? Is it less? Does it mean less informative? Would the authors miss something important or informative too? What if
Yeah.
there are some answers that was posted on this Zifu app, 99 words, 98 words, 90
Yeah.
words, slightly less than 100
Yeah.
words.
Mm.
Would you want to say that, well, because it's less than 100 words, then it's less likely to be more quality or less rich in terms of data? So that you want to keep in mind. But there's another way that they have kind of tried to make their data credible, and the way the data collection credible is that they have randomly put aside how many five
Five
answer.
question. For
You
answer.
to
Yeah.
double check, after they've done
Yeah.
all the coding, whether and check with these five that I I I assume they put it aside and then they come back to see whether they have reached the saturation. So
Yes.
kind of a
Yeah.
coding saturation test. I never
Yeah.
know this can be done, So this is something really new, and you can
Mm.
see, is it robust enough? I really hope quality researcher could give us some good comment whether this is acceptable or not. If you believe this journal, you know that early this year has been delisted from Q1, isn't it? This journal used to be very good. I mean, it used to be Q1, but now we are now putting a big question mark on this quality of this journal, isn't it? The time this journal has published, I mean, this was 2022. It was Q1. It was supposedly to be very strict peer review process and journal selection process. And yeah, but if they got through some expert peers reviewer comments, so I suppose this could be acceptable as something robust way of doing a qualitative analysis. But I would not be 100% sure lah. Yeah, I
Mm.
hope I
Yeah.
have actually invited our Monday quality research workshop speaker to be on board, and they said they are busy and they may come on board if they are available. Not sure they are here or not. Otherwise, they may make comments whether this process of qualitative data uh, collection, whether it's okay or not. Does it sound okay to you, someone?
To me, because my big question is who is their participants, the user of the apps. So it is not mentioned in the
Mm,
papers who are their users, but basically I go read a bit about the Zero apps, as I mentioned previously, that among of their users are professionals in various of field like ITs, healthcare, designers, and so on. And
okay.
80% of their users are degree holder and above, and 2% are
I
PhD
see.
holder. Yeah, so I
Oh,
think that this platform actually provides intellectual opinions. So I think that
yeah.
it might be suitable. So I feel that
Oh,
it
hiding
is quite
a
yeah, it's
different
quite
kind of strata of the society lah,
yeah.
not
I
the
mean,
common
no,
public.
no, no, no. And then the
That's
users
good point.
reside, yeah, and then the users reside at the big city of China, like Beijing, Chengde, and so
Okay.
on. So it's, the users are
Mm,
among of intellectual persons. So I think it's quite acceptable to me. Yeah.
yeah.
Mm.
Okay. So this could only explain the illness experience of this so-called high higher level of
Yes.
uh, public in the society lah,
Yeah. And then the
not the
question,
common.
yeah, and then the question approved by the admin of the apps is basically an intellectual question only. Yes.
Okay, that's a
Yeah,
very
and
important observation.
simple question will not be approved by the admins.
Oh,
Yeah,
is
so
it?
so
Okay.
it is a serious platform to discuss something. So I feel a bit confident using this method. And when I read about the grounded theory, I feel that this study, the approach that they use is quite acceptable. Yeah,
Quite acceptable to you, but
yeah,
interpret it to the higher level of the society lah, not the common
yeah,
people lah.
yeah.
So all the theories that they have derived could only be applicable to those in a highly educated
Yeah.
intellectuals
Yes.
society. May
Yes.
not be the common people may not be able to so-called self-compassion, isn't it?
Yes. Yes. Yeah.
May not be trying to what biographical flows or that.
Yeah. Yeah. And then to change
Mm,
their hobbies or lifestyle
yeah,
is not easy for common people.
isn't it?
Yeah. Mhm.
Common people may suffer in silence or that, isn't it?
Yes. Yes.
Okay, thank you for that. Is there anyone in the audience can help us giving some comment on the process of this data collection?
Yeah, because I would like to know how actually they filter or transfer the answers from the apps to via Python. I'm not sure. I have no idea how they did that actually here.
But the final 64
Yeah.
answer remain, isn't it?
Yeah,
It sounds
remain.
like quite a good, quite a rich kind of a data pool to go into lah.
Yeah, I'm not
Initially,
sure
it's
about that,
even
bro.
more, isn't it?
Yeah,
But yeah,
I'm not
so
sure either
qualitative lah.
64. Yeah, either 64 is enough. I'm not sure. I have no idea about that.
Later we can discuss whether we can, transfer the result, whether we can agree with the theories. Maybe we can proceed to what you have.
Yeah, it's almost towards the end, basically.
Sure.
Okay, this paper also highlight the limitation of their data collection was that they done it from only one online community, which may impact their results. And they suggest for future research that try to examine the illness experience of long COVID patient on social media with a more diverse user composition. Like we discussed just now, is only among highly educated people. So also use a mixed method approach for data collection to ensure the rigor of the data, and then to compare the similarities and differences in patient illness among across countries and cultures, as what you said just now, Prof. Maybe it turns differently in our setting as compared to China. Okay, we come into the appraisal items, which I use the CAPS, Critical Appraisal Skill Program for qualitative study. So section A, it asks about other result valids. Was there a clear statement of the aim of the research, like goals, importance, and relevance? And I think it is yes. What about you, Prof?
Yes, agree the first one, but not so sure about the second one.
Is a qualitative method appropriate to address the issue? I think it's yes, because I read about the participants and then I go read about the grounded approach theories, and I found I think it's acceptable. It's not acceptable, what the words, rasa boleh diterima. Lepas mengambil kira about their study, the participants, and then the method they use, I think is yes to me.
But one
Yeah.
thing is that they have saved a lot of, effort and cost in the data
Yeah.
collection. Can you imagine if they want to do it as in the standard manner?
Setting.
They
Yeah.
have to select the respondent, they have to go
Yes.
and
As
interview
mm,
and all the verbatism, and then they have to transcribe.
yeah.
But now by doing this, they have kind of cut short that step. Straight away they get the so-called transcript. It's a
Yeah.
free transcript, and then they analyze on the transcript. Can you imagine how much they
Mm,
have been so-called efficient?
yes. But that's the purpose of grounded theory approach, Prof. Because they use the world real data. This is what from I read, that you use the data that are ready or readily available, like from
But
the interviews,
whether
like photos. Yeah.
whether the answer in the Zifu app is sufficiently rich, that I cannot be 100% sure.
Right.
You know, whether because they did not interview, they cannot explore, see,
Yeah.
any issue that they have so-called noted on the Zifu app. Some they may say something like, I feel like I'm dying, like social death. There's one quote. If they did the interview, they can explore. What do you mean by
Yeah.
you feel
Yeah.
like you are dying or that kind of thing? But they can't do that, see. So they rely
Yes.
on just whatever that is been given on the app.
Yes.
So that part I can't be very sure lah, whether
Okay.
it's good enough for the grounded theory approach.
Yeah. Okay.
So be careful on that.
Okay. And the next question, number 3, is it worth continuing? Was the research design appropriate to address the aim of the research? Has the researcher justified, authors justified or discussed the method used? And yes, even though I think that some of the methods like how they use Python and then how they use NVivo 12 is not discussed or detailed in the paper, but I think is well discussed in the paper about the research design. And then was the recruitment strategy appropriate to aim of the research? I think it's yes, because of the way how grounded theory been done is it is based not only from it can be interviews, it can be readily data from the media social, like any platforms, like from a photograph. So it's like it's quite, the data source of the for this grounded theory approach is come from different methods. So one of that is the media social platform. So I think it is yes for me for this question.
I will
Yeah.
not be so sure about it.
Yeah.
Qualitative researcher may not accept it. I just guess lah. Because the one thing that is not, I mean, not so-called acceptable is that they can't explore. They cannot actively explore. They just receive whatever they are there. But they try to prove their methods to be robust by doing the saturation.
Yes.
They thought, even if I interview, then it will not be anything new. So it has been saturated.
Yes. Yeah.
But still,
The difference.
what you want to say?
The difference of the grounded theory approach as compared to other methods like ethnography or phenomena is that, like other methods, they try to prove or disapprove the hypothesis. But for this one, it's just to derive a theory. It's not to approve or disapprove anything. Prof, that's the difference. That's why I said that I kind of set this as one of, acceptable to me because of the methods itself.
Yeah, I mean, we can learn
Yeah.
more Monday. From qualitative
Yeah.
workshop.
Yes.
For those who want to learn more about qualitative research, I think we have a workshop on Monday. Later, perhaps we can show you the poster here also.
Yeah. Okay, that's what's the data collection in a way that address the research issue? So I put it yes. And has the relationship between the researcher and participant been adequately considered? So cannot tell.
I cannot tell. Why not no?
Yeah, because they have no contact
Not
at all,
mentioned, is
right?
it?
Not
Yeah.
mentioned.
Not
Yeah.
mentioned. Yeah. How can you be sure? If you want to be sure about this, write to the authors and ask.
Yeah.
Okay.
What are the results? Have ethical issues been taken into consideration? Cannot tell because it didn't mention anything in the paper. So we really need to consent this? I'm not sure. I have no idea. In this method, I'm not sure.
Yeah, if they want to do it, how are they going to do it? They may put on a Zifu app that I'm going to take your answers, that kind of thing, for analysis.
Yeah, I'm not
But
sure.
do
Maybe
they
ask
do
the
they
person.
do they also capture all the personal information like the patient's occupation, age, gender, all that?
Not mentioned, Prof,
They
in the
did not,
paper.
isn't it?
Yeah.
So it's just purely based on the textual answer.
Yeah.
Yeah.
Maybe just supposedly the authors need or the researchers need to apply approval from the Zifu app, the owner of it. I think that's it.
I think one of the qualitative research, they need to inform the readers and audience about who were the respondent so that we can transfer the result to other setting. And in this paper, it wasn't actually given, isn't it? Who were the respondent, the personal characteristic of the respondent.
No, not mentioned clearly in the
Yeah.
paper. It just,
So
yeah.
so you wonder, how come this
Yeah.
kind of report also can be published in Q1 journal? This
Yeah.
journal has been delisted, I think must be for that issue as well.
Okay, number 8, was the data analysis sufficiently rigorous? I think yes, but for now I'm not sure, Prof. Because after takes few consideration, but after you said, some key points, I think that we need to see against, the result. how they
Yeah, I
derive
also
their
wanted to
theory and
hear
so.
the I also wanted to hear the experienced qualitative researchers' opinion, whether they can accept this or not. They may not be, they may not want to accept it, but for efficiency purpose, can you imagine they have
Yeah.
been so efficient? Whether this could be a good one, or this should be something like lead to a better qualitative research on the same topic. Maybe
Yes.
it could be that way and not conclusive, like, in a sense.
Yeah. Okay, number 89, is there a clear statement of findings? To me, is yes. They put educated discussion of the evidence. They highlight three main findings like self-image, management, impression management, and self-compassion. I think yes. And then how valuable is the research? Contribution to existing knowledge, I think yes, because they derive something as I'm present feels like at the beginning of the presentation is that because the other researchers there are limited studies on the illness experience of the COVID patients. So this study actually provide new knowledge towards the topic.
But ways of use, the finding may not be able to do that if they don't tell us their study samples characteristic.
Yeah. Yes.
Mm.
Yes, I think I left the slide about the
It's okay.
conclusion for this. Yeah.
It's okay.
Okay, anything
Maybe there's
else
one
about
thing
this?
there's one, is it worth continuing? This is very interesting point on this checklist,
Mm.
If you don't score yes on the first two, it tell you, you can just throw this paper in the rubbish bin.
Mhm.
Not worth continuing. But fortunately, someone, you not waste the time that you think is worth reading, that's why you go all the way lah.
Yeah,
Okay.
yeah, yeah.
I think whether it's good or not good, I think this paper also present to us something very educational. Yeah.
Yes,
So between efficiency and productivity, or uh, whether you can apply this kind of online readily available data for your research. So this paper actually shows to some extent you can do it, but whether that extent is good enough for the research objective. So you want to be uh, considerate and more careful lah.
yes, that's right. Okay, this is the conclusion part. This study actually analyzed and recorded the self-produced stats of patients of COVID having long symptom of COVID in the online QA community Zihu through the qualitative analysis software and Vivo. And they found that the result patient with long COVID not only suffer from pain of the disease, but also stigma and discrimination. And then how they turn their illness experience into motivation to rebuild their life again, and then reconstruct their life again with new goals and targets. And the authors also suggest that in the conclusion that to the policymakers, the study may help to understand the living condition of long COVID patients in China and how the policymakers can develop relevant intervention policy to provide medical support and psychological guidance for this patient, and then also to create a supportive and inclusive social environment to stop the spread of unsubstantiated COVID-19 rumors and convey correct health information and reduce stigma and prejudice against long COVID patients. So that's the conclusion of the paper. Okay, I think I've reached to the end of the
That's
presentation.
all, yeah.
Yeah, that's all.
Okay. Right. Perhaps I would like also to make a comment on the conclusion. If you want to appraise or you want to appreciate qualitative research, you want to get the quality criteria of a qualitative research, like in this paper, in this report at the end, they have not actually done a few steps that we consider as important quality steps for qualitative research, like something like about uh, member check. If you have analyzed all this, quality researcher or research, uh, if a good one, they will actually go back to the respondent, telling them, oh, these are what we analyze, and we think these are the theories to explain your experience. So they will, this member check, they will get the respondent to look at the result and to tell them whether they have analyzed it fairly or not. This is one thing. And the other thing is that they have not, they assume all the respondent in the Zifu app applicable to general public. This similar to Savannah, which you have checked the Zifu app. Majority of the users are not really common people, so they conclude in such a way as if like is applicable to all the general public, which I believe, Savannah, the Zivo app users and the way where they get the data from are not common people and
Yes.
public in China. So the conclusion there in that manner, strictly speaking, is incorrect. It's wrong.
Oh, yeah.
Otherwise, people maybe go away thinking that this is applicable to all the Chinese people, which may not.
All right.
Okay, so that's all from Savannah. I would say thank you very much. It has been a very, very nice presentations.